Hi, everyone. Welcome to the Healthy Homes Program Update, July 2024. First of all, I want to thank Gina because I thought her presentation about the IDA program was so very helpful, and I attempted to model some of these slides after that presentation. So I'm just going to kick us off here. So I wanted to start out by giving some really high-level context about the Healthy Homes Production Program that is operated by the Department of Housing and Urban Development, or HUD. And as you all know, we are well into our second year of this grant that began last April 1st. And this is a program that has actually been around for a couple of decades. It is run through the Office of Lead Hazard Control and Healthy Homes, and so you'll see lead hazard grants and healthy homes grants often referred to in the same sort of bucket of money, although the grants operate a little differently. And the purpose of Healthy Homes is really just to ensure that everyone in this country has access to safe and healthy housing. It was launched in 1999 over concerns about child environmental health. So there's a very strong focus on serving families with children. And the sort of new approach when this began back in 1999 was that they wanted to focus on housing safety in a more coordinated manner, so that they're looking for comprehensive healthy homes assessments. They're looking to kind of look at the whole of the home, including the property inside and out, to look at all of these things rather than just going to fix one item at a time was sort of the plan. So these are some of the major hazards that we are looking for when we go into the home. And there are several goals for this program. I am going to talk about the first three. There are something like 9, but the first 3 are kind of the primary goals that we are looking at. So HUD wants us to use this funding to reach the greatest amount of residents in need and also the greatest amount of housing units. So they are looking for numbers. They're looking to reach, as many folks as possible with funding. We have the goal of identifying housing-related health and safety hazards in owner-occupied low-income housing. And like I said, especially in units with families with kids, in households where there are older adults age 62 and older, and also families with persons living with a disability. And that is not to say we can't serve other eligible low-income households. We do, but these are sort of the priority populations. And then the third primary goal is to promote cost-effective and efficient healthy home methods and approaches that can be replicated and sustained. So looking at best practices, in fact, the HUD report that I'm submitting today talked a bit about our home repair summit, which was really wonderful to share with them, and looking at longer term sustainable approaches that fix the problems or mitigate the hazards, so that we, in fact, we're not allowed to go back to a household, let's say, that has received some repair work and go back 6 months later. That's like not okay. So we really want to look at assessments that are comprehensive, that identify everything. They may not go in and fix everything, but at least we know, what the hazards are that were identified. And so last year, we received a grant from HUD for $2 million. It's a 3.5-year grant, and the better whole of the first year was really spent largely in getting the program stood up and running. There was a lot of stand-up activities or startup activities, and there is a lot of compliance to this program. So it is been, we've invested a lot of time in getting this up and running. We originally actually said that we would do 200 homes. We reduced that benchmark goal to 160, kind of based on guidance from our government technical representative, as to what we realistically could do in the 3 years. And also we're learning that our average project costs are a little bit different than what we had maybe anticipated. And we're finding that most of our projects are actually coming in, around 8 to 10 to 12 and 15,000 even. And as of just about a month ago, we can reimburse up to $15,000 per project without HUD permission, which is great because originally it was 10,000. But if it comes in and if the budget comes in at over $15,000, we do have to ask for permission from HUD to support what they call high cost units. And that's been going pretty well. We have several pending, but they've also already approved a number of those without too many questions. And so this is just a little snapshot of our benchmark. These are cumulative numbers. So you can see here at the top, this is the number of housing units that we have identified or done assessments on. And then here at the bottom, this is how many we've said that would be completed. So we are a little behind here because this number 4 and this number 8, we did not complete those projects in those quarters. I've recently adjusted this so that in the current corner, you'll see 0. Actually, the quarter that we just finished, I've changed that to 0 just to give us a little bit of cushion there. But we think we'll be back on track by the end of the fall season for sure. Since several are in progress, they're just not officially done. Ultimately getting to our goal here of 160 projects. And I guess I'll pause and just say that 160, I don't have the numbers in front of me, but each affiliate was allocated a certain amount. And at the start of this project, we were working with 5 affiliates. Roughly, each of them was given about 25 units, with the exception of West Tuality, who got, I think, closer to 40 or more, because they are more of a higher performing, and they were like ready to go earlier than some of the other affiliates. So those allocations have been adjusted somewhat. These are our 4 partners, Newburgh area, Lincoln County, Tillamook County, and West Tuality. And again, West Tuality has sort of taken the lead because they were ready to implement earlier than some, but they've all received training and they're all, I think, working really hard. And we're excited to be seeing, in particular, I think from Newburgh, they have just hired a new construction and repair coordinator within the last 3-4 months, and he has really hit the ground running, which is exciting. And so just what is it, what's in it for the affiliate, just especially given the compliance requirements? We are paying them to do this work, not only reimbursing them for the direct costs of the repair work itself. So for example, we pay them for intake, which includes things like documenting environmental reviews. We pay them for post-repair work at the end of the project, and when then we make available things like translation. Nobody has taken us up on that yet, but we have money funded for translation and interpretation if we need to. And then we do fund them for the labor and for the equipment, supplies, and so on. And then we also pay them or provide or reimburse them for different training activities. So all of the affiliates had at least one, I think at least maybe 2 staff take the Healthy Homes Assessment training that Prisilla, Rihanna, and I also took earlier this year. And then we are offering ongoing training in things like developing a scope of work, putting together their budget. And then we're going to be doing site visits soon, which is exciting. So I think, this grant, one of the goals that was not on my slides is that it's a learning grant. So they're looking for workforce development, capacity building, training, again, that sort of theme of like sustainable program work that will last beyond the grant period. And again, these are the major areas or bodies of work for healthy homes. These are the 8 principles that we are required to include in our assessments, so that the goal is that the home is kept dry, clean, safe, pest-free, and so on. And so these are sort of the categories, and when you're looking at the home, that all of the work will fall under. And I think I'll turn it over to Prisilla.
Yeah. So thanks, Sarah, for all that background. I will jump in to talk about the Healthy Homes program activities. We have an environmental review, which is called a tier 2, that those are submitted on an ongoing basis. And those have a 30-day window of when the affiliate submits the unit to the SHPO, which is the State Historic Preservation Office. And so once that 30-day window is up, we can submit the environmental tier 2 review to HUD. They review it and then get back to us. It can take anywhere from 30 days to 45 days, sometimes a little less. The ones from Newburgh actually came in within a week. And so that is great to see, because I know they were very burdened with a lot of tier 2 reviews and not enough people, but it's great to see that maybe they've hired some folks there. The affiliate conducts income verification. So the income verification for each client is 80% AMI, according to HUD, and lower. So the affiliate does their own income verification. We provide some documentation if they need some assistance, but basically they're all trained to do that for their own affiliate. As well as healthy home assessments and scope of work, as well as a budget. So they develop these assessments and budgets for each project, submit it to us, and then we take a look. If it is over 15,000 proposed amount, then we ask for HUD for permission to proceed, and they take a look at the home assessment, the tool, the scope of work, the approved tier 2, and then approve it. And so far we've gotten all of them approved for high cost units. If the unit is under 15,000 proposed costs, then we just take a look, everything makes sense, and we send it over and approve it for the affiliate, and they can start the work. There's also repair and mitigation of health and safety hazards. So as Sarah mentioned, HUD doesn't just want roof replacement. They also want, is there suspect mold? Are there any leaks? Or like a wholesome home repair. And then the last two are post-work inspections, reimbursement, and reporting. So post-work inspections haven't happened yet because we haven't had any completed units yet, but so hopefully those will happen soon. And then as well as getting regular reimbursement from us for lead and radon testing and invoices. And then Sarah does reporting. So those are just a few of the regular activities that go on every week. Next slide, please. So for tier 1, in November, I believe is when our tier 1 was approved for the entire state of Oregon. And it evaluates and analyzes the impacts that these kinds of projects will happen. So I believe you all took, I think this was before I was hired, you all took a look at hazards for any activities on the coast or anything near airports or anything like that that could be gathered information from the internet and based on records and data. And so then that was approved. And then those lead into tier 2s is the next slide. I talked a little bit about tier 2s. Those are on ongoing basis. We need maps and pictures of the home, as well as NEPA maps, so EPA regulated facilities, echo reports, proof of home ownership, that they pay taxes on the property, and lots of other compliance heavy materials, but they are all necessary. And I think the next slide will show, yes, how many so far we have. So Sarah mentioned we have 160 allotted units across all 4 affiliates right now. We have 21 approved tier 2 environmental reviews as of yesterday afternoon. 10 are not yet approved. That means either they are pending with HUD or they haven't been completed yet, or just waiting on the affiliate to do some work towards them. But then that would leave 129 available units. So we're about 20% of allocated allotted units so far. And then next slide. Yes, and then compliance. These are all just some of the documents that are needed that we use our database, our Salesforce database to collect things from contracting licenses to tier 2 checklists and maps, all the way to lead and radon testing, budgets, scopes of work. So our Salesforce database has really helped to keep all of these documents together instead of either emailing them across affiliates or in our Dropbox or even just printed. I know some people still have printed documents, but our database has really helped to keep these documents together in one place. And I believe that is it. If anybody has questions for us, we'd love to chat with you.
I have a question. The environmental reviews, and I kind of remember this from the beginning, but I wanted to just clarify. The environmental reviews are not having to do one of those per project, right?
Not the environmental, the tiered 1, those that was just one and done, but tier 2s need to be done for every single project. Oh, it looks like Sarah needs to go. Hi, Sarah. But sometimes depending on location, one tier 2 can approve multiple projects. So that was with Newburgh recently. They had 2 projects within 100 feet of each other because they were in the same manufactured manufactured home park. So because all the maps are going to be the same, all of the EPA regulated facilities are the same, it would just be, I think, the radon and or lead testing if they needed it per unit. But other than that, we were able to do one tier 2 for 2 units. So that can sometimes happen if the geographical location is close enough.
Cool. Thanks.
Hey y'all, I'm in the corner of the library and I think I have to go. I don't think I'm supposed to talk here. So somebody was walking back and forth in front of out of the room, and like a young man, he's probably like 15, so I let him in. So I'm sorry, I know we kind of, that was a whirlwind and we rushed through that. Thank you, Priscilla. But yeah, thank you for allowing to share, and I'm gonna hop off, let Priscilla answer any questions, and I'll see you all soon.
Bye, Sarah.
I may have a question that only Sarah can answer.
Okay, but I mean, you can ask.
Yes, I'm gonna ask, and then maybe you can give me maybe the summarized version or something. But I was curious, like, since we now only have 4 affiliates, it sounds like you redistributed that funding to West Tuality, and I'm just curious, is there the possibility of scooping another affiliate if at all needed, and or in order to use the funds, or if we find an affiliate has been building capacity and is ready to use some funding and jump into the program? Is that a possibility over the next 2 years?
Yes, it is a possibility to scoop up some affiliates, as you called it. We're thinking, and this is just something that Sarah and I talked about yesterday. David Reeder, who works with both Newburgh and McMinnville, McMinnville could be a candidate just because they already have David trained from Newburgh. So that would be a very easy and fast affiliate to bring on board, because as you know, Rihanna, they would need to go through the 3-day training. They would need to really catch up on months and months of training and meetings that we've had, and guidance and HUD compliance as well. With West Tuality, they had actually reached out initially to ask if there were any more funds available. So I believe that's why some of that funding went to them, just because they are keeping up with their production numbers that they've told us. But yes, there is definitely potential for more affiliates to come on board.
Thank you. That was that's exciting though, that and I assume that that 20% that is spent at this point is really feeling on track, seeing as you've done all this prep work, right, to get to this point.
Yeah, we anticipate that the 20% of allotted clients, and I just say that because there's an intake form, there's at least some kind of interest from the affiliate to go forward with it. So about 20% has been allotted, and there's intention. And I mean, Junction City had 7 units, and those we we were able to report them as completed intake forms, but you know, that's all they were. We were not able to count them towards the 160 of completion, especially because they're not going to move forward. So that's just a little bit of setback.
And they didn't get funded for those 7 is what that means, even though they were ready to move forward on them. Is that
They
correct?
had submitted intake forms, but they
Okay.
never submitted reimbursement forms or anything like that. So we did not reimburse them for lead or radon testing. I think we might have just reimbursed them for some training to get Anthony trained at 3-day Healthy Homes training.
Okay.
Any other questions?
Thanks, Priscilla. I was curious, have you had any unexpected challenges in the, program implementation? How has it been working with the various agencies?
Yeah, so working with HUD has been very interesting because so in April we went to Minneapolis for our training for our mandatory national conference, and we just learned a lot, but also came back with a lot of questions because they'll give some guidance, and then maybe it's just not super clear, or it's just so heavy of understanding that, you know, we're still just working through some lead compliance. We've met with the city of Portland, who also has a HUD lead hazard control grant, and they're really great at some guidance they gave us as to when to test for lead, when not to. So we're still learning in that realm of just some compliance piece, because it is very heavy with that. And then some setbacks. I mean, Junction City disaffiliating is for one, but then also maybe there was one homeowner who just had to move, and either had an emergency family issue come up, and they can no longer occupy their home, so they either need to sell the home or rent the home, and so now they're no longer eligible for it. So they had an intake form, but then now we can't move forward. So again, we can count it towards our assessments completed, but not no fruit's going to come from it. So that has just been some challenges in keeping the affiliates connected to the homeowners, scheduling. I know Esquality has a lot of subcontractors they're working with, the roofers and plumbers and all of that. So keeping those regularly scheduled and in contact with homeowners. Hope that answers the question.
Yeah, thanks.
Okay, so if there are no more questions, I'd like to thank you for your attention. And I wish Sarah was still here, but I'm sure she would also say thank you.
Nice. This was really helpful, actually. It was really nice to learn about the program. Thank you both for sharing the team. I think that, you know, Megan and Shannon aren't here, and we've got new staff coming on, and they're going to really enjoy probably the summary as well. So it was super helpful. Thank you.
Thank you.